Hi y'all, this video is going to discuss the position of the heart and the characteristics of the pericardium. If we look at the position of the heart, number one, you should remember that the heart is located in which cavity, which body cavity? If you said thoracic cavity, you are correct. So it's located in the thoracic cavity, and the space where we find the heart has a name, between the lungs. It's the name of a song, between two lungs. It is called the mediastinum. So if you look here, the heart, can I draw? Pen, there is my pen. Okay, so the heart right here is located posterior to this structure right here. What is that structure? It is the sternum. So it is located posterior to the sternum and somewhere between the second and fifth ribs. And it has a slight tilt to it. So if we look right here, this region of the heart is this conical shape. It's about the size of your fist, and it is tilted so that the pointy region, called the apex of the heart, points towards your left hip, and then the superior region, which is formed by the great arterial trunks right here, is called the base of the heart. So we have the apex and the base, and one thing we should note also is that it is located mostly to the left of the midline of the body. So it's not directly centered, it's slightly shifted to the left of the body. Okay, it has a superior border and an inferior border. And if you look right here on this figure, the inferior border is kind of resting on the diaphragm. And then also what we are looking at right here is the right side of the heart. So not only is it tilted and more so to the left of the body, but it's also rotated so that the right atrium and right ventricle are more anterior, while the left side of the heart sit more posterior. Okay, this figure right here, so here we have the cadaver figure, a picture from the cadaver, and what we're looking at right here is the right ventricle. So the right ventricle sits more anterior because it is rotated about its axis. And then this figure right here is a CT scan. Not really going to go too much into that, but what you should note in a CT scan is that we're typically looking at an inferior view. So we're looking from the bottom up. Okay. Now, it sits in the mediastinum, and if you think about it, what we learned previously in chapter 1, when we learned about body cavities and membranes that surround our organs, we learned about serous membranes, right? So nothing changed here in that the heart, as you remember, is enclosed in a serous membrane. It's called the pericardium, okay? But what we didn't discuss is that it has the serous membrane, right, has two layers from what you remember. There's the layer that touches the organ, and that is called the visceral layer, and the parietal layer, which typically touches or lines the cavity. Now, what the heart has is this extra layer of pericardium that we call the fibrous pericardium. And it's this tough sac of dense connective tissue that holds the heart in place. If you think about it, it's constantly, throughout your entire life, contracting and relaxing. Now, rather than have the heart bounce around within the thoracic cavity, we have a fibrous pericardium which functions to basically anchor the heart within the mediastinum. Okay, and it it anchors the heart inferiorly right here to the diaphragm, and then superiorly to the base of the great vessels right here. So the pericardium is very, very important. We have the fibrous pericardium, which is on the outside and anchors the heart in the mediastinum. And then we have the serous pericardium. The serous pericardium is our serous membrane. And if you remember from chapter 1, what is the function of these membranes? They produce some kind of fluid, right? Serous fluid. And that fluid goes in between the parietal and the visceral layers, right? And that fluid functions to maintain lubrication, right? And it is in between the parietal and the visceral layers. So that is called the pericardial space. And if I tell you that it's a potential space, you should immediately think that this is not an actual space. It is a potential space in that if we have some kind of disease or itis of the pericardium, we would be in trouble. And what would we call it? We would call it pericarditis, right? So that could be any inflammation of the pericardium, viruses, bacteria, fungal infection, right? That could lead to an enlargement of that pericardial space, and then we would be in trouble, right? So in a normal functioning person, the pericardial space or pericardial cavity here, as your book calls it, is the thin space between the two layers of the serous pericardium. Okay, so that's it for the position of the heart in the thoracic cavity and the sac that surrounds the heart, or the pericardium. Okay.